Trastuzumab is a medication used to treat certain types of breast, stomach, or esophagus cancer. It is specifically used to treat tumors that produce more than the normal amount of a certain substance called HER2 protein. Trastuzumab is a type of medication known as a monoclonal antibody, and it works by slowing or stopping the growth of cancer cells. It is available in different forms, such as trastuzumab, trastuzumab-anns, trastuzumab-dkst, trastuzumab-dttb, trastuzumab-pkrb, and trastuzumab-qyyp. The dosage and timing of this medication should be determined by a doctor based on individual circumstances. This medication is administered slowly into a vein by a healthcare professional, typically once a week or once every 3 weeks, with the first injection lasting at least 90 minutes. The dosage is determined by your medical condition, how you respond to treatment, your weight, and any other medications you are currently taking. Make sure to inform your doctor and pharmacist about all the products you use, including prescription drugs, over-the-counter drugs, and herbal products. Using this medication regularly will help you get the most benefit from it. To help you remember, mark the days on your calendar when you need to receive the medication. Your doctor may also prescribe other medications, such as acetaminophen or diphenhydramine, for you to take before each dose to help prevent serious side effects. Be sure to follow your doctor's instructions carefully. Some common side effects of Trazimera may include redness or irritation at the injection site, diarrhea, muscle or joint pain, stomach or abdominal pain, headache, trouble sleeping, nausea, vomiting, mouth sores, and loss of appetite. Your doctor may prescribe medication to help with nausea and vomiting, and eating small meals or limiting activity may also help lessen these effects. Remember that the benefits of this medication outweigh the risk of side effects for most people. Contact your doctor right away if you experience symptoms of heart failure, bone pain, numbness or tingling, mental or mood changes, fast or irregular heartbeat, or easy bruising or bleeding. Seek medical help immediately if you have chest pain, weakness on one side of your body, trouble speaking, vision changes, or confusion. Be aware that Trazimera may lower your ability to fight infections, making you more susceptible to serious infections. Contact your doctor if you experience signs of infection such as a persistent sore throat, fever, chills, or cough. Additionally, be mindful of any rash and inform your doctor if you develop one. While serious allergic reactions to this medication are rare, seek medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you experience any other effects. In the US, you can report any side effects to the FDA. In Canada, you can report side effects to Health Canada. Remember to consult with your doctor for medical advice about any side effects. Trastuzumab, also known as Trazimera, is an intravenous solution used as an Antineoplast EGF receptor blocker recombinant monoclonal antibody. It is used to treat certain types of cancer. It's important to note that trastuzumab may cause serious heart problems, including heart failure. The risk of heart problems is increased if you also use an anthracycline, such as doxorubicin. Your doctor may stop treatment with this medication if heart problems occur. Reactions may happen with your injection, usually during or within 24 hours of the dose. Careful monitoring may decrease your risk. Tell your healthcare professional right away if you have symptoms such as fever, chills, flushing, headache, nausea/vomiting, trouble breathing, dizziness, weakness, or feeling faint. Your doctor may slow down or temporarily stop your injection. It's important to be aware that trastuzumab can cause serious harm to an unborn baby if used during pregnancy. It is crucial to discuss reliable forms of birth control with your doctor if you are of childbearing age. Before using Trazimera, make sure to let your doctor or pharmacist know if you have any allergies or if you have a history of certain medical conditions such as infections, heart disease, lung problems, or previous cancer treatments. Trazimera may increase your risk of getting infections, so it's important to avoid contact with anyone who has a contagious illness. It's also important to let your healthcare professional know if you are planning to have any immunizations or vaccinations while using Trazimera, and to be cautious with sharp objects and activities that could result in injury. This medication can also cause dizziness, so it's important to avoid alcohol or marijuana, and to use caution when driving or operating machinery. It's also important to inform your doctor about any upcoming surgeries, as well as if you are pregnant, planning to become pregnant, or breastfeeding. It's important to be aware of potential drug interactions that could affect how Trazimera works or increase the risk of serious side effects. Make sure to keep a list of all the medications and products you use and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without consulting your doctor. Trazimera is similar to other medications such as trastuzumab-deruxtecan, trastuzumab-emtansine, and trastuzumab hyaluronidase. It's crucial not to use any of these products while using Trazimera. Always follow your doctor's instructions for the best results. If someone has taken too much Trazimera and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Before starting Trazimera 420 mg intravenous solution Antineoplast EGF receptor blocker Recomb monoclonal antibody, it's important to have medical tests done, such as heart exams and complete blood count. These tests should also continue while using this medication. It's important to keep all medical and lab appointments. Make sure to take each dose of Trazimera 420 mg intravenous solution Antineoplast EGF receptor blocker Recomb monoclonal antibody as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine a new dosing schedule. This medication is typically administered in a hospital or clinic setting and should not be kept at home. It is used to treat certain types of cancer and works by blocking the action of a protein in the body that can promote the growth of cancer cells. The dosage and timing of administration will be determined by your healthcare provider based on your specific medical condition. It is important to follow their instructions carefully. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.